This is Dr. Ramakrishna Avadhani, Professor of Anatomy, Yenepoya Medical College, Yenepoya University. Today I am going to talk on the facial nerve, the seventh cranial nerve, under following headings. First, introduction, then nuclei of the facial nerve, the course and the parts, the branches and the supply, and finally applied anatomy. Facial nerve is a mixed cranial nerve, but predominantly a motor cranial nerve, having a very small sensory root, which is better known as the nervus intermedius or nerve of Risberg. It is a nerve of the second pharyngeal arch. So it has to supply all the muscles derived from the second pharyngeal arch, which includes 22 muscles of the facial expression, posterior belly of the digastric, stylohyoid and stapedius. In addition, the facial nerve is going to supply secretomotor to the lacrimal gland, submandibular salivary gland and sublingual salivary gland. It carries taste sensation from the anterior 2/3 of the tongue and general sensation to the posterior wall of the external auditory canal and posterior half of the tympanic membrane. The course of the facial nerve, all the nuclei are located in the pons. Facial nerve has got 5 nuclei. They are motor nucleus, superior salivatory nucleus, lacrimatory nucleus, nucleus of tractus solitarius, and nucleus of the spinal tract of the trigeminal nerve. The course of the facial nerve is divided into 4 parts. First part is called the intrapontine part. The second part is called the intracranial part. The third part is called the intrapetrous part. The fourth part is called as extracranial part of the facial nerve. Today I am dealing with the facial nerve because this is the commonest of the cranial nerves which is getting paralyzed. The reason behind is the facial nerve is having little complicated and adventurous course. The first part of the facial nerve is going to commence from this nucleus which you are seeing. This is the transverse section of the pons, and where my cursor is located is the motor nucleus of the facial nerve. Unlike other cranial nerves which are going to start from the nucleus and run straight forwards and emerge from the ventral aspect of the brainstem, facial nerve fibers initially runs dorsomedially, winds around the abducent nerve nucleus and then turns to run ventrolaterally to emerge out at the junction of the pons and the medulla oblongata. This abrupt curvature is called the internal genu of the facial nerve, which is going to produce an elevation in the floor of the fourth ventricle that is called the facial colliculus. The first part of the facial nerve, which is running through the substance of the pons, is having extra length because of this unique course, which is explained by the phenomenon of neurobiotaxis. According to this phenomenon, the functionally related cranial nerve nuclei within the substance of the brainstem will migrate towards each other during embryonic life. So facial nerve nucleus is going to migrate here towards the chief sensory nucleus of the trigeminal nerve, which results in this unique course of the facial nerve within the substance of the pons. Any obstruction of the pontine artery which is supplying one half of the pons results here in Millard-Gubler syndrome, where there is facial palsy on the same side and hemiplegia on the opposite half of the body. The second part of the facial nerve is going to commence at the pontomedullary junction and is going to end at the internal acoustic meatus, which is hardly 1 inch in length, but very important because it runs through an area called as cerebello-pontine angle. Since this is the commonest site of brain tumor, over 60% of the brain tumor occurs in the cerebello-pontine angle. This part of the facial nerve is closely related to the 8th cranial nerve. Both these nerves are invested by a common sleeve of dura mater, arachnoid mater and pia mater, where the motor and the sensory roots of the facial nerve are clearly visible here. This is the motor root of the facial nerve. This is the 8th cranial nerve, vestibulocochlear nerve, and this nervous intermediate, so sensory root of the facial nerve, is sandwiched between the motor root of the facial nerve and the 8th cranial nerve. This part of the facial nerve is affected whenever there is cerebello-pontine angle tumor. In that case, we have associated facial palsy along with that tinnitus and progressive deafness, since that tumor is going to compress both the 7th as well as the 8th cranial nerves. The third part of the facial nerve, better known as intrapetrous part of the facial nerve, because here both the internal auditory canal as well as the facial canal are harbored in this petrous part of the temporal bone. The first 1 centimeter of this part is running in the internal acoustic meatus, so we call it as meatal part, where it is accompanied by the 8th cranial nerve till it reaches the bottom of the internal acoustic meatus, where you have a thin plate of bone called the fundus, which separates the internal auditory canal from the inner ear. That is where the 8th cranial nerve is going to terminate by supplying the inner ear, and the facial nerve is going to leave the company of the 8th cranial nerve and enters the facial canal, a narrow bony canal which is a zigzag canal. Here we can see that course of the facial nerve inside the facial canal. Initially it is going to run over the labyrinth, so we call it as the labyrinthine part of the facial nerve, which is going to run over the inner ear till it reaches the medial wall of the middle ear cavity, where it is going to abruptly turn backwards over the promontory, and that bend is called the external genu of the facial nerve, and that is the place where you can see a ganglion called the geniculate ganglion of the facial nerve. The tympanic part of the facial nerve is going to run over the promontory, that is called as the transverse part or the horizontal part of the facial nerve. As it reaches the posterior wall of the middle ear, it is going to turn downwards to finally emerge out of the facial canal, and this is what is called the stylomastoid foramen. That is the end of the third part of the facial nerve and the beginning of the fourth part of the facial nerve, better known as the extracranial part of the facial nerve. The third part of the facial nerve gives 4 branches. The first branch is this greater superficial petrosal nerve, which arises at the external genu of the facial nerve from the geniculate ganglion area, and this branch is going to supply secretomotor to the lacrimal gland and the mucosal glands which are scattered all over the mucosa of the nasal cavity, paranasal sinuses, palate and the nasopharynx. The second branch is called as nerve to stapedius, which is going to supply the small muscle which is present in the midlear cavity, which controls the smallest bone in the human body, that is the stapes. Then the third branch is the chorda tympani nerve, which is going to arise from the facial nerve about 6 millimeters above the stylomastoid foramen and is going to pass through the midlear cavity and emerges out through the petrotympanic fissure to enter into the infratemporal fossa, where it is going to join the lingual nerve. This chorda tympani nerve is a mixed branch of the facial nerve which is going to supply the secretomotor to the submandibular and sublingual salivary gland. It also carries the taste sensation from the anterior 2/3 of the tongue. The last branch of the facial nerve inside the facial canal is called the communicating branch, which is going to communicate with the first branch of the vagus nerve. We call it the auricular branch of the vagus, also called as Arnold's nerve or Alderman's nerve. Which is going to supply the posterior wall of the external auditory canal and the posterior half of the tympanic membrane and the concha of the ear. So, because of this branch, whenever there is herpes zoster infection of the geniculate ganglion of the facial nerve, along with the facial palsy, lower motor neuron type of facial palsy, the patient will have severe shooting pain and vesicles in the area of distribution of Arnold's nerve or Alderman's nerve, that is the auricular branch of the vagus, because of the connection or communicating branch. The last part of the facial nerve is going to commence at the stylomastoid foramen. We call it the extracranial part of the facial nerve, which is going to run initially downwards. Then it is going to turn forwards to enter into the parotid gland. This is that largest and purely serous salivary gland, which is divided into 2 lobes by this facial nerve, that is the larger superficial lobe and smaller deep lobe. Facial nerve is going to enter the parotid gland via the posteromedial surface. Initially it is going to divide into 2 divisions. This is what is the temporofacial division, upper division, and this is what is the lower division, better known as cervicofacial division. Each division is going to give rise to now terminal branches. This is what is the temporal branch. This is what is the zygomatic branch of the facial nerve. This is the upper buccal branch of the facial nerve. The lower cervicofacial division similarly is going to divide into 3 branches. This is the lower buccal branch of the facial nerve. This is the marginal mandibular branch of the facial nerve, and this is the cervical branch of the facial nerve. All these terminal branches of the facial nerve are going to emerge out of the parotid gland via the anterior border of the facial nerve. But remember, the facial nerve is not going to supply secretomotor to the parotid gland, though it runs through the substance of this gland, though it divides this gland into two superficial and deep lobes, but the same facial nerve is going to supply secretomotor to the other two salivary glands, that is submandibular and sublingual salivary glands. The extracranial part of the facial nerve also gives three more branches. This is what is that posterior auricular branch of the facial nerve, which is going to run upwards and backwards behind the pinna of the ear to supply the occipital belly of the occipitofrontalis. And this is the branch to the posterior belly of the digastric and stylohyoid. Thus, the facial nerve extracranial part is going to supply all the muscles of the facial expression, which includes about 22 muscles on one half of the face, plus three more muscles. They are posterior belly of the digastric, stylohyoid and stapedius muscle, which it has already supplied inside the mid ear cavity. Even this fourth part of the facial nerve is opting for little adventurous course because it runs through the substance of the parotid gland. So, any tumor of the parotid gland or abscess of the parotid gland, the facial nerve may be affected. Whenever we want to drain parotid abscess, we have to put incision parallel to the branches of the facial nerve to avoid injury to the facial nerve. Similarly, whenever we do parotidectomy for any parotid tumor, we have to take care not to damage the facial nerve branches to avoid the facial palsy. To conclude, the facial nerve lesions can be divided into supranuclear, nuclear and infranuclear palsies. The nuclear and infranuclear palsy will be lower motor neuron type of facial palsy, where it is going to affect the half of the face on the same side, whereas in case of supranuclear paralysis, there will be paralysis on the opposite half of the face. The upper half of the face is going to escape paralysis because of bilateral representation of the upper half of the face. And these are the symptoms of the facial palsy in the lower motor neuron type, where the disappearance of the transverse wrinkles on the forehead, drooping of the eyebrows, wider palpebral fissure, ulceration of the cornea, ectropion, drooping of the lower eyelid, epiphora, spilling of the tears, loss of nasolabial fold, deviation to the normal side, angle of the mouth motionless on the smiling, sags and may drool, accumulation of the food in vestibule because of the paralysis of the buccinator muscle, pursing of the lips, labial speech affected. Thank you.